Hospital offers a low-dose CT lung cancer screening to those who might be at risk for lung cancer. The screening can help detect lung cancer much earlier. Joining us today is the Director of Lung Cancer Screening Program at Griffin Hospital, Dr. Richard Salzano, and lung cancer patient Diane Ostano. Lung cancer patient not anymore, though, right?
Not anymore.
It's been how long since you've been cancer-free?
Just over 4 years.
That's fantastic.
Yeah.
And you credit this program with saving your life.
Absolutely.
Great.
Absolutely. If it weren't for this program, I wouldn't be here.
That's fantastic. Doctor, tell us all about the program.
Well, the idea is that historically lung cancer has been a problem to find early, and most patients at the time of diagnosis have been little to no chance of being cured. Lung cancer screening, the idea is to find cancers early when they're curable. With a patient like Diane, she has a 90% cure rate from her surgery, which is excellent. And that really turns the disease around and makes it a much more of an impact in terms of what we can do in our community.
Sure. And who goes through these screenings?
So it's based upon your smoking history.
Okay.
So it is only for high-risk patients, and that risk is based upon their smoking history. In a certain age group, with a certain amount of smoking in their history, either current or within the last 15 years having quit smoking.
And what's the process? A first-time patient arrives, and what happens?
So usually the referrals are made by primary care physicians who bring it up and talk about it with their patient and explain the objectives. Most patients, fortunately, 99% of people are going to be found cancer-free, which is great, and it's that 1% where we really make an impact.
Sure, and that was you, Diane.
That was me.
What was that like? What was the day like? What happened? Bring us back.
Well, I had no symptoms, no signs. I had gone to Griffin Hospital, and they'd give me a little postcard, and I put it in my pocketbook, and it was just, I kept pulling out. It was getting annoying.
I should probably do this, right?
So that's basically what I did. I knew I had been a smoker. I had already quit for several months, and I says, you know, in the back of my mind, let me put my mind at ease, and that's when I made the phone call. And I went in for the CAT scan first, and I got a little nervous because they didn't give me my results right away.
Okay.
And they made me make an appointment. And that's
is that typical, doctor, or is that...
No, it's not, and that's, you know, it's only the patients with a significant finding who will actually see a physician in the program. The program, similar, I think many people are familiar with the process with mammography, where you know, you go and you have your screening and you're told, we'll see you next year. That's the vast majority of our patients. But then when there is a significant finding, the idea is for them to come in, for me to go through the process, evaluate what that finding means and what we're going to do next.
So, Dan, you were coming back for a follow-up.
That's when I knew when they said I had to meet with Dr. Salzano, that's when I knew that there was something up.
Okay.
So at that point, that's when I got nervous. But once I met with him, no, the nerves were gone.
And you came up with a treatment plan, I'm assuming?
Exactly, and it's very driven by experience. We know what we need to do based upon certain findings. We put patients through a process, biopsy and treatment.
Sure.
And in her case, we found a very early stage lung cancer, and we're looking at a 90% chance of her. We've got one more year when we can pronounce her cured, which is what we're anxious to get to that point.
All because of the program. And if our viewers at home are hearing about this program or are interested, you'd advise them to contact their primary care doctor? I
think the best thing is to talk about it with your primary care physician, and they can go over your qualifications or your eligibility for the programs. And then a referral can be made through our Griffin Hospital website, griffinhealth.org. There's information on the contact and the process for getting into our program.
Very good. We'll check out the website there. Dr. Salzano, thanks for being here, and congratulations. I'm so happy to hear you're healthy, Diane.
Thank you. And thank you.